And good morning, everybody. It is Fabulous Friday featuring Monica Dabney. Now, I met Monica, or rather, she got in touch with me. She was wanting to collaborate with a load of specialists in our area, wellness specialists, and we immediately got on because we're so like-minded. Now, Monica, you have been doing acupuncture for 25 years, and I find you absolutely fascinating to talk to, again, because we're so like-minded. However, Monica, tell us, how did you get into acupuncture?
First of all, let me tell you, thank you, first of all, for engaging with me. Second of all, I'm fascinated with your mind, too. You are one of the most brilliant women I've ever met. And following your question, I got into this because I own medical centers. I employ doctors, nurses, physical therapists, and I didn't like the way that things were flowing. A patient comes in, pays his bill, gets a prescription, comes back, same thing. Things weren't flowing. Then over and above that, right around that time, my now 38-year-old son was diagnosed with ADHD. He was in second grade then. The only thing we had at that time that we knew of was Ritalin. So I took him to the best pediatric neurologist. He was the head of Baptist Hospital in Miami. And lo and behold, 15 minutes later, we come out with a prescription that lasts 24 hours. We had to fill the prescription in 24 hours because it's a controlled substance. So we did this for almost a school year, and I couldn't do that again. He had terrible side effects. It really didn't correct the situation. I wasn't happy at all. And I'm discussing this with one of the nurses that worked for me. And she says, why don't you try acupuncture? I said, what's that? Well, these Chinese people and the needles, and kind of like, that's crazy. I can't have my little boy being stabbed with needles by some crazy Chinese person. And the neurologist that worked for me cuts into the conversation and says, guess what? I went to Hong Kong to study that. And I said, you, a neurologist? And he goes, let me tell you, it works. And if I were you, I'd give it a try. We did, never took medicine again. So Needless to say, I am a very inquisitive person, and I went back to school for 4 years. And at that time, it was 4 years plus 650 clinical hours, and became board certified and practiced pediatrics for about 7 years into my career. Then a lot of things happens when you treat children. Some parents follow through, some don't. And it's you have to stay on a treatment. Like anything else, is a treatment. And it's lifestyle changes. You have to change your diet. You have to change, the food that you feed your children, the food coloring, the stimulants, all those video games and all that kind of stuff. So some parents complied, some didn't. So I said, what is the best way that I help children through their brothers? So I went and just from then on worked women's health until today.
Yeah, I love it. I love it. And I'm so with you on that. I really dislike medicines. I mean, they have their place, and I've got to be careful with that. And I would never go against what somebody's being prescribed. However, I do get curious. I think it is important that people do think again and think outside the box. What else? What else can I do? And then with conjunction, we can collaborate perhaps with other doctors. And I know there's lots of functional medicine doctors as well that help people. And but I love it. So, and I like acupuncture. I think it's great. I've had it. I use it. So yeah, wonderful.
And Claudia, it's not just acupuncture. Well-being and wellness in itself, it takes a village.
Oh.
And sometimes acupuncture may not be the right medicine or the right modality for a particular person. Maybe hypnosis is, maybe lifestyle changes, maybe diet, maybe exercise, but the good thing is that there's a group of us that we know this, and we support it. We support not only each other's practices, but we support the patient himself, because we're not here for us. We're here for the patient and the client.
Exactly. It's for the person. And you're right. It's a little bit of this, a little bit of that, and everybody has their own ingredients, if you like, that will work for them. So, and you've organised. There's a whole group of us, and we're coming together. It's June the 8th, isn't it, at Holly Springs?
Yes,
So,
I'm excited about that.
Yeah.
Holly Springs Farmers Market, June 8th, from 8 a.m. to noon. And we're all going to be there. And Claudia is going to tell you exactly what hypnosis is and how it can help and what you can do. I'm going to talk about trauma and PTSD and what we could do from our perspective, our more natural perspective. Dr. Chitanan is going to speak about lifestyle changes and stress. And we have Brianne that's going to tell you what breath work is all about. That is amazing. We have 2 massage therapists with massage chairs. And I think we're going to have a ton of fun. But the most important thing is that we are going to deliver information to the community. And I think that many people just don't know that there is something else besides what they have been taught or given or prescribed. And there is so much more to medicine and wellness and body-mind well-being.
Yeah.
And, we can help in many cases. We can help from a natural perspective.
Yeah, because the body keeps the score, and it's it's inside, and it's just a whole. What else? What somebody can do that. Somebody can do that. As you say, it takes a village, and so we're all there talking about the various things that we can do, and it's just to help people understand it and educate them on what it is and what it isn't a lot of the time.
I think the most important thing is that we're going to be there able to answer questions. And I'm sure that a lot of people have questions, and we're going to be there present with ample time to sit and talk to somebody and answer questions and just be present and listen. Most of the times we go to the doctor nowadays. As a matter of fact, I went to the dermatologist today. I think I was outside in the lobby longer than I was inside with her. And I had to really deliver my concerns quickly. Okay, I'm getting old. I'm getting these. I don't like him. What do I do about him? And, just check my skin. And it was in and out. And people are dissatisfied. People are dissatisfied. They don't feel heard. They don't feel, they're taken seriously or into consideration with all their ailments. And you have to put all those things together. You have to listen to what the body is saying, what the mind is trying to tell you, how the person feels, what are the symptoms, and then really sit with a human being and see him as a human being.
Absolutely. I give a lot of time. My first session is 2 hours.
Yeah.
And sometimes that's all they need. I completely get to build that rapport with that person in that time, and I'm so focused on them, and I love that I get to do that. Yeah,
I think the listening part of it is what we miss the most in medicine. And it's not that you don't need to take a medication. By all means, if you have an infection, you have to take an antibiotic. You take an antibiotic. If you have an acute inflammation, you might need to take some steroids for a few days. But I always say the best medicine is the one not taken. So there are things that we may need to take for a short period of time to get our bodies back to balance or homeostasis. But there's no, I think, need to take something permanently, knowing that if you take a certain medication, you're going to be harming one of your vital organs. So what do we do? Let's say that you are very overweight and you are hypertensive and you're a diabetic. what is the first thing we're going to address? It's not putting a pump on you to just constantly deliver, insulin. It's going back to, okay, what's going on? Your self-love, your responsibility about your own personal health. Then we tackle diet, then we tackle exercise. And you can reverse diabetes in many cases. You can lower your cholesterol naturally, and you can reverse hypertension. I have seen it done. It can be done. Not always, but in most cases.
I see people for hypertension. I've got because it can often be from anger, or is it too much salt, or is it the smoking? Is it that, is it that belief that you're going to have it because it runs in your family? Is it, or what is it? It's all these things, and it's a lot of it, we can change in your mindset. Anger is a big one.
Mild stress, it's going to raise, there's the systolic, which is the high blood pressure, and the diastolic, which is the low blood pressure. Many times the systolic is high and the diastolic is fine. That means your body's okay, but your mind is not. You're anxious, you're stressed, you're worried, you're concerned, you're scared. So all those things are going to raise your systolic. So we don't take a pill. We manage the stress and the root cause of what's causing the hypertension. If it's the diastolic, then we have to address the body. I like what you said about believing that I have to suffer from something because my family suffers from it. And we're going to have this conversation. I think it's going to be a long conversation, you and I, because what I have seen is, and this is my perception, we need to have a tie to our family. We're tribal. We need that line, that lineage to our family. So we say, okay, my mother was depressed. That's why I suffer from depression. Or my grandmother had diabetes. That's why, I try to tell my patients to find that lineage to their families and to find that tribal need, maybe with more positive things, rather than saying, I suffer from depression because my mother suffered from depression. We could say, I have my mother's beautiful eyes. I have my grandmother's smile, and we can find that link without necessarily going into the illness part of it.
I know, because it works the other way as well, of course.
Yeah.
Because some people have longevity in their line. They go, oh my, they live until they're 100, so therefore they think I will. It's like, okay, that's a good one. We'll keep those ones.
Absolutely, we can love our lineage, but we can take from it the positive and not necessarily the negative, and we can make the changes in our own personal lives so that we don't acquire that negative part of the DNA.
Exactly. So I know it's fun, isn't it? There's all sorts of different facets to this. So anyway, Monica, you and I could probably talk forever. And I will no doubt have you back on here again. So it's, but everybody have a wonderful day, and it's goodbye from me, Claudia Ricard, and it's goodbye from Monica Dabney. All right. So thank you.
Thank you.
Bye. Bye now.
Bye.
Bye-bye.